You're watching Unicef television. One of Uganda's newest citizens, baby Brian, days old but already graduated out of the most fragile moments in a child's life, thanks to being born here. With a mix of the age-old African bush telegraph and innovative ways of using modern technology, Uganda is pushing ahead to reduce child mortality. In less than a generation, it has cut the number of child deaths by 2/3. Since last year, a rapid SMS system known as M-Track has taken off countrywide. Through the system, health staff track diseases and drug stocks. They test and treat patients, send updates via text to a central dashboard, leading to better management of the medicine supply chain in real time. It all means fewer sick children and happier health workers.
We are quite happy, overwhelmed by this. We are seeing now our communities now are believing in our services, and now we are now demanding for more space. What initially we couldn't think of, we are now demanding for more space, more equipment, more drugs. We are no longer experiencing wastage of drugs because of underutilization.
Villagers themselves, through a program of community dialogue, have helped feed the demand for better health services. And the M-Track system has cut time and costs.
Previously, if a facility had a drug stock out, they would have to wait for 3-4 months for the next round of drug supplies. Right now, the district can be able to look at his M-Track dashboard and identify which facilities have sufficient stock, which ones have a stock out, and be able to do a redistribution within his own district.
Volunteers from village health teams like this woman are on the front line against the big killers of children here, like malaria, pneumonia and diarrhea.
N'okulya obulungi n'okubeera nga nina ekizibu ekintuuseeko ne ngenda mu ddwaliro bwe bityo.
It's all starting to give Uganda a reputation of being something of a laboratory of change for children. This prototype is being developed to beam vibrant health messages out to remote rural areas like Karamoja in the far west. The results so far have been popular.
I mean, they were totally amazed seeing something like that. First of all, many they have never seen any thing like a healthcare video or something like that, and then we even had it in their own local language, in Karamoja language.
Some of the tools made here are tested out by children on the ground at this centre supported by Unicef. This digital drum, which streams life-saving information in a fun, child-friendly way, is helping close the digital divide. Technology can be a game changer for development here, but the balance with basics is seen as key.
It's a lot of the basic nuts and bolts, frankly. I think it's sanitation, it's water, it's electricity, it's staff, it's access. So I think it is going to be a shared commitment, and we really need the government of Uganda to really step up. They have an excellent plan, but we need to be working together to implement that plan effectively.
With rapid urbanization and the third highest fertility rates in the world, this East African country that crosses 2 hemispheres faces a future where children will count for more. This is Sarah Crow in Bukumansimbi, Uganda, reporting for UNICEF Television. For more information, go to unicef.org.